Brainsway 104 System Training for the Treatment of Major Depressive Disorder, MDD. This video will walk through the procedure to operate the Brainsway DTMS system for the treatment of patients with major depressive disorder. DTMS therapy works by applying a magnetic field to non-invasively stimulate the brain. The unique design of Brainsway's H1 coil enables the device to stimulate broader and deeper neuronal pathways than other common treatments, which have been shown to often miss important depression targets. Major depressive disorder is treated using the H1 coil, which targets the bilateral prefrontal cortex, primarily the left side. Deep TMS is well tolerated and has been shown to be effective for patients who have not responded well to other treatments. The Deep TMS system consists of several components: the helmet containing Brainsway's H1 coil, the positioning arm enabling placement of the helmet, the foot pedal allowing hands-free triggering, the cooling system, which maintains proper temperature of the coil during repetitive usage, the easy-to-use touchscreen interface, allowing the operator to program the treatment and record data. Beyond the physical device, you'll require patient cap, which enables proper positioning of the coil and ensures hygiene, a stable, comfortable chair, earplugs. It is important to disinfect the device prior to usage to ensure safety for patients and staff. We recommend using a 70% isopropyl alcohol wipe to disinfect any areas that may pose a public health concern for your patients. Should additional hygienic precautions be required, consider having the patient and device operator wear masks. Physical setup. Position the chair about 2 feet in front of the system. Make sure the patient is seated comfortably, upright in the chair. Ask the patient if there have been any changes in behavioral or underlying factors that may impact motor threshold, such as changes in medication, sleep, or alcohol use. Ask the patient to remove any metallic items above the neck, including hairpins, clips, glasses, and earrings. Have the patient insert earplugs and ensure they are properly positioned. Patient data setup. Turn on the system by flipping the main power switch on the back of the device and log into the touchscreen interface. The touchscreen interface allows for the operator to store patient data securely on the system and allows for the tracking of several metrics, including the patient's helmet position, the patient's motor threshold, and various patient scores, such as the PHQ-9 at the beginning of each session. Search for a patient using any of the fields to get to patient record or create a new patient. To create a new patient, press New Patient at the bottom right corner of the screen. Enter the name, ID or medical record number, date of birth, and gender of the patient to continue to the pre-treatment screen. From this patient record screen, you will need to set up the patient with the proper protocol by pressing the Assign Protocol button on the left side of the screen. The system features built-in treatment protocols cleared by the FDA for MDD and OCD. Once you have selected the correct protocol, press the Begin Session button at the bottom right, which will take you to the pre-treatment screen. The pre-treatment screen is the portal for all treatment activities. From here, you can go to one of 3 options: Find MT, Adaptation, and Treatment. Patient preparation. To begin, place the patient cap onto the patient by lining up the bottom of the cap to just above the eyebrows. Make sure that the red vertical line of the cap is aligned with the midline of the patient's head. On the back of the cap, pull the midline strap gently to ensure that the cap is snug against the patient's head. Pull the left and right peripheral straps, crossing each other, and fasten them to the back of the patient's head. Fasten the cap's chin strap. Next, attach the positioning grid by aligning the red tip of the midline arrow over the patient's nasion and align the rest of the grid on the cap. Motor threshold, or MT. A motor threshold, or MT, is the minimum output required to stimulate the desired area of a patient's motor cortex. This will result in a visible contraction of the muscle group that the stimulated region controls. The motor threshold is a surrogate measure of cortical excitability, allowing you to determine the correct TMS treatment dose. In order to find the MT with the H1 coil, you will locate the motor cortex region which represents the right hand and then determine the minimal dose required to activate it. Motor threshold setup. Press Find MT on the pre-treatment screen. Position the patient with their right hand relaxed and their palm faced upwards so that any finger movement is easy to observe. Press the button on the front panel, turning it from blue, indicating the system is in standby, to solid green, indicating the system is ready to deliver pulses. Position the helmet over the patient's head so that the vertical red line of the transparent guide rests over the red line of the grid and the horizontal AB line is at 7 centimeters. Set the intensity to the starting value of 50 and arm the stimulator by pressing Charge. Now, while holding down the helmet firmly, press the foot pedal or press Pulse on the screen to deliver a single pulse. You are looking for a contraction of the muscles in the patient's right hand. If you do not observe any contraction, increase the intensity by an increment of 5 and deliver another pulse. Continue increasing by increments of 5 until a visible muscle contraction occurs. Once you see any movement in the patient's right hand, record the response as weak, mild, strong, or strongest. You will see the data recorded in the location helper on the right side of the screen. Motor threshold location. Now, you will begin to optimize the position of the helmet. The goal is to locate the position that generates the most robust response by moving the helmet in all directions. First, move the helmet 1 centimeter in the anterior direction to 6 on the anterior-posterior axis, making the corresponding adjustment on the touchscreen grid. Deliver another pulse and record the response. If the response is stronger, continue moving in 1 centimeter increments in the same anterior direction. If the response becomes weaker, move in the opposite posterior direction by increments of 1 centimeter. Once you have located the optimal position on the anterior-posterior axis, you will identify the best position on the lateral medial axis. Move the helmet 0.5 centimeters in the right lateral direction, making the corresponding adjustment on the touchscreen grid. Deliver a pulse and record the response. If the response is stronger, continue moving in 0.5 centimeter increments in the same direction. If the response becomes weaker, move in the opposite direction. Now you have determined your motor threshold location. Motor threshold intensity. You will now assess the motor threshold intensity. Decrease the intensity by 1 and deliver up to a total of 6 pulses at each intensity level. Record the responses. Continue decreasing the intensity in increments of 1. Deliver up to 6 pulses and continue to record the responses. The lowest intensity with at least 3 out of 6 pulses showing a visible motor response will be the MT intensity. You now have both the motor threshold location and intensity. Press Set MT to lock in those values. MDD treatment. Now you are ready to initiate the treatment. In order to find the treatment location, move the helmet 6 centimeters in the anterior direction from the motor threshold location. Note that regardless of the patient's intended treatment location, never position the gray fabric on the inside of the helmet below the supraorbital line. Once the helmet is in position, tighten the helmet's chin strap under the patient's chin and pull the back strap down and cinch the cord in the rear of the helmet to finish securing the helmet to the patient's head. Brainsway provides you with a foam spacer that can be inserted in the back of the helmet, if necessary, to ensure a more snug fit on patients with smaller heads. On the pre-treatment screen, adjust the coordinates to match the helmet's treatment position and ensure that during the first visit the power output is 100% of the motor threshold. The optimal and maximal treatment intensity of 120% of the motor threshold will automatically be calculated in subsequent sessions. In many cases, such as the patient's first visit, it is recommended to apply short adaptation trains before starting the actual treatment to assess whether the patient reacts well to the pulse train. Press adaptation to deliver the test trains, adjusting the treatment location and intensity as necessary. Upon entering the adaptation screen, you will always see a pop-up with several pre-treatment reminders. Once you've found the optimal treatment intensity and location via adaptation trains, save those parameters by pressing Done and go to Treatment. Turn on the cooling system by flipping the switch on the front panel of the system. The temperature displayed on the screen should be lower than 14 degrees Celsius or 57 degrees Fahrenheit before treatment is initiated. Arm the stimulator by pressing Charge and then inform your patient that you are about to begin the treatment. Count down from 3 and either step on the foot pedal or press Start on the screen. The treatment will automatically stop after 55 trains, taking approximately 20 minutes. You can also stop this treatment manually at any time by hitting the red button next to the dial or by pressing Stop on the screen. At the end of the treatment, you can view the patient's treatment data by pressing Treatment Summary. Turn off the cooling system. Open the chin strap and back strap to remove the helmet, then remove the cap and earplugs. Save the cap for the patient's next treatment. Administrative features. There are several system settings that can be used by administrators. For example, in Tools Users, you can add, edit, or remove operators. Operators with administrator privileges can edit users, back up the database, and update the software. In Tools Network, an operator with administrator privileges can connect to the clinic's Wi-Fi network. In Tools, Info and Update, an operator with administrator privileges can back up the system database onto a flash drive, which we recommend you do periodically. The Brainsway Deep TMS system is a unique platform technology designed to treat a variety of mental health conditions. You can learn more about Brainsway technology and our treatment options by visiting www.brainsway.com. Should you have any questions about treatment protocol, please consult our reference materials. Call us at 844-386-7001 or email us at deeptms@brainsway.com. Thank you for partnering with us.